At UNC Health Appalachian, we pride ourselves in a multidisciplinary approach to patients' health care. We will first see the patient in our clinic. Typically, we can see patients within a week. It's a very rapid turnover between the referral and being able to get the patient set up for a minimally invasive diagnostic procedure to determine if they have a cancer or not. Then we discuss those patients at a multidisciplinary tumor board. So if it turns out to be cancer, for example, we will have a weekly tumor board in which the surgeons meet with the cancer doctors, both the radiation oncologist and the medical oncologist from the cancer center. There's also a pathologist there who interprets the histology or the tissue to determine what type of cancer we're dealing with. And also there's a radiologist who is reading the x-rays and helping us determine from the x-rays what, for example, the stage of the tumor would be, or whether this tumor would be best treated with surgery or non-surgical forms of care. We also are involved in collaborative care of our patients with many of the other primary care providers and specialists, either in this community or in other communities if the patients are being referred from other communities. So, for example, I have collaborative relationships with pulmonary medical specialists in other communities and also cancer physicians in other communities. And oftentimes patients from those regional communities will be referred here. We'll be involved in the diagnosis or treatment of their cancer from a surgical perspective, but then we will also collaborate with their cancer doctor in their community because, for example, some of these patients may require preoperative treatments prior to surgery or postoperative treatments after surgery, or may choose just to be followed up closer to home. And so we are typically collaborating with those physicians as well. Also, we may be collaborating with, for example, cardiologists here in the community when we're going to operate on a patient. We always take a holistic approach to patient care. We are not just looking with tunnel vision at the surgery itself. We want to be sure that the patient's surgery is done safely. So oftentimes, if patients have cardiac history, we're collaborating with their cardiologist or their primary care physician to make sure that they're in optimal health prior to going to surgery. Sometimes they go back to see their cardiologist for clearance studies before we even embark on a major operation. So we're very fortunate to have that type of relationship with our referring providers.